Hi there. My name is Dr. Sang, and my project is the transition from pediatric to adult care for youth with chronic diseases, focusing on youth, caregiver, and provider perceptions. With the advancement of medicine and technology, more pediatric patients are living into adulthood, and the majority of youth with chronic diseases will inevitably need to transfer from pediatric to adult care. Despite a multitude of guidelines to facilitate the transition from pediatric to adult care, young patients continue to be lost in follow up at a time when they're the most vulnerable. While the needs of youth in the preparation and duration of transition processes have been widely assessed from the pediatric lens, few studies exist that examine the ways in which youth post transition would like to be supported as they step into adulthood and the autonomous management of their conditions. This study takes an innovative approach to investigate the needs of young patients as they age out of pediatric care. Specifically, the study directly involves youth as co-researchers, or YCR, from the creation of research objectives and implementation to data evaluation and knowledge translation. This three-phase mixed method study gathered data using an iterative approach with the collaboration of the YCR. First, provider opinions were gathered via a survey administered at the 2017 AAP. Secondly, data was collected through 15 separate, semi-structured standardized interviews of adolescent medicine physicians across Canada and the United States. Third, perspectives of adolescents and young adult patients and their caregivers were gathered independently using a 20-item survey. Respondents rated current transition processes on an average of 5.19 out of 10 on a 10-point Likert scale, with 1 being poor and 10 being excellent, with no participating rating 9 or 10 out of 10. The top barrier identified was a lack of communication between pediatric and adult physicians. Other concerns include lack of insurance coverage, lack of physicians able to take on youth transitioning to adult care who are also knowledgeable regarding pediatric conditions, and lack of funding or staff support for transition clinics. When asked about improving the transition process, the top-ranked strategy for improvement was to improve formal transition guidelines. Other suggestions included increased education of clinicians regarding transition and increased education and involvement of patients and families in the transition process. A majority of youth surveyed reported that their physicians have not involved them in conversations about transitioning. Youth reported much poorer transition experiences compared to caregiver perspectives. Factors that make it easier for youth to navigate the transition process include availability of healthcare providers at a university or adolescent clinic that are more aware of youth health considerations, providing communication directly to young patients, and use of external programs for transitions. The difference in ideal timelines for transition proposed by youth compared to caregivers still revealed preference by youth for an earlier start to transition, which has also been previously documented. Recommendations for pediatric providers include addressing the young patient directly during appointments, assigning direct responsibility to the young patient, and eventually seeing the patient alone in appointments without their caregiver. Successful transition requires adequate follow-up, post-transition, by adult providers who are knowledgeable about the care of adolescents and young adults. Challenges also continue to exist in siloed transition programs. Joint clinics divided by specialty will not solve the issue of pediatric to adult transitions alone. Programs must be designed in a thoughtful manner to allow for appropriate communication between all specialists involved in care, as well as adequate understanding and diligence by young patients. It is important that comprehensive community supports related to the post-transition care of young patients be included in order for transition to be successful. A brilliant pre-transition preparation process is futile if post-transition care is unavailable or inadequate. Thanks very much for listening to my presentation.